What if one of the simplest little experiments for feeling a bit calmer and more steady has been sitting right in your kitchen spice rack this whole time? Picture this. You grab a single whole dried clove. Yeah, that tiny spice you've probably walked right past hundreds of times without thinking twice, and you just tuck it under your tongue for about 30 seconds. No fancy capsules, no expensive powders, no complicated routines, just one ordinary clove. Now, before we go any further, let's be real with each other right from the start. This isn't being pitched as some miracle cure or breakthrough medical treatment. It's a low-cost, personal experiment based on traditional practices and some interesting early science. Right up front, I want to be super clear. There is currently no strong clinical evidence from human studies showing that this exact whole clove under the tongue method delivers measurable, systemic health benefits. What we're going to explore today are the biological reasons why some people find it worth trying. But we're keeping our expectations realistic and our eyes wide open. Why the way something gets into your body actually matters. Most of the time, when we swallow herbs or supplements, they go through the full digestive ride. Your stomach acid breaks them down, your intestines absorb what survives, and then your liver does something called first-pass metabolism. That process can knock out a big chunk of the active compounds before they ever reach your bloodstream. The tissue under your tongue is different. It's thin and loaded with tiny blood vessels. This sublingual route lets certain compounds slip into circulation more directly, potentially bypassing some of that heavy processing. That's actually how some fast-acting medications are designed to work. A single dried clove happens to be rich in a compound called eugenol, the stuff responsible for that warm, slightly numbing sensation. Eugenol is fat-soluble and biologically active. Some lab and animal studies have looked at how it might interact with different systems in the body. What the science actually says and what it doesn't. So here's the natural next question. What might eugenol actually be doing? Laboratory studies and animal research suggest it has antioxidant properties that may help neutralize free radicals and reduce oxidative stress over time. Other preclinical work has explored whether it might support mild blood vessel relaxation or play a role in how the body handles insulin and blood sugar. Plus, the area under your tongue is packed with sensory nerves tied to your autonomic nervous system. That familiar warming feeling might send subtle signals that could gently influence your stress response. But here's the honest reality check. Most of this evidence comes from test tube experiments, animal models, or studies using clove extracts, not from people using whole dried cloves sublingually. Solid human clinical trials on this specific practice basically don't exist yet. So any potential benefits would likely be modest, subtle, and cumulative at best. How to try it safely. Step by step. If you're curious and want to experiment with this yourself, here's the safe, practical way to do it. Pick one whole dried clove, not ground or crushed. Place it gently under your tongue, toward the front or side. Let it sit there undisturbed for just 20 to 30 seconds. You'll probably notice a mild warming or slight numbing sensation. That's completely normal. After 30 seconds, take it out and throw it away. Don't chew it or swallow it whole. Keep it to no more than 2 to 3 times per week. More isn't better and can irritate your mouth. Best timing is usually mid-morning or before a meal. I wouldn't do it right before bed if you're sensitive to that kind of stimulation. Important safety notes. This is not risk-free. Even though whole-dried cloves used this way are generally low risk for most healthy adults when done occasionally, this practice is not completely harmless. Eugenol is a potent compound, and there are no official medical guidelines for using cloves sublingually. You should skip it, or talk to your doctor first if you take blood-thinning medications. Eugenol has mild effects on platelet activity. have active mouth ulcers, severe acid reflux, or known allergies to cloves, are pregnant, breastfeeding, or dealing with any serious health conditions. And please, never use concentrated clove essential oil under your tongue. It's way too strong and can burn or damage tissue. This is not a replacement for real medical care, prescribed medication, or advice from your healthcare provider. It's just one small exploratory habit. So, why even bother? You might be thinking, if the effects are probably small and the evidence is still early, why waste 30 seconds on this? Fair question. Here's my take. Real health isn't usually built from one huge dramatic change. Our bodies respond better to small, consistent patterns over time. A brief interaction with your nerves here, a little antioxidant exposure there, or a gentle nudge in circulation or blood sugar response. These tiny inputs can quietly add up when they're part of an overall healthy lifestyle. Most of us are chasing that one magic bullet. In reality, feeling better long-term usually comes from stacking a bunch of small, doable things that actually fit into real life. Good food, movement, sleep, stress management, and maybe even this simple clove experiment. Final thought. If you decide to give it a try, approach it with curiosity, not big expectations. Pay attention to how you feel in the hours and days afterward. Notice any subtle shifts in your energy, calmness, or comfort. If it feels good, great. If not, just stop. No big deal. Sometimes the smallest experiments end up teaching us more than the loudest promises ever could. Thanks so much for your attention today. I'd love to hear your thoughts, or take any questions you have.